Ready?
Yeah. Happy Friday, everyone. Today we are the new Hampton BioMed, which is the melding of Stand Wellness and the Morrison Center from New York City. And here I am with the most esteemed healer I know, Dr. Jeffrey Morrison.
Yeah, thank you for making time for us. We appreciate it, and it's exciting to have you here. I know you've traveled a long way, so thank you.
Yeah, I just got off the plane from Colorado. I'm so happy to be here with you. This is just such an honor because Dr. Morrison took me down a healing journey when I first got Epstein-Barr and then Lyme disease and all sorts of other autoimmune issues. So thank you so much for that.
Yeah, and you've been through a lot of different types of treatments, so you've really seen what healing is about.
I have, and one of the modalities of that healing journey have been intravenous medicines and vitamins and minerals. And Dr. Morrison has been doing this for what seems like centuries, but it's been about a few decades with the Morrison Center in New York City. It's where everyone goes to heal. So I want to get started with you on IV therapy. And before we jump into that, where did the idea for Hamptons BioMed come from?
This was a kind of a partnership that's been developing for at least 5 to 10 years. Through a relationship that I had with one of my previous patients who's become a friend, Tap Frank in Gola, and she's opened up a wellness center in Watermill that we had the good opportunity to sublease space from. And I kept on wondering why all of our patients were going downstairs to get like some special treatments. I visited and I saw these amazing modalities like red light bed and firefly and PEMF treatments and saunas, and what I saw was that when patients were combining our IV treatments with the therapies that she had on her floor, they were getting much better results. And through a conversation we had, we realized, boy, it would be so much better if we kind of combined our energies in a new space, which is now Hamptons BioMed, where we are two practices that work collaboratively for our patients' best interests. And magically, 3 or 4 months ago, we did it, and here we are.
Here we are at 223 Hampton Road in Southampton.
Yeah.
Formerly Stand Wellness, now merged with the Morrison Center, and it is Hamptons BioMed. I said Hampton BioMed before, so
yeah,
I want to
and
correct myself.
The reality is once people get here, they just realize that it feels good, the energy is great, and people are getting better. It's nutrition, it's mindfulness, but it's also really effective therapies. And this kind of, the whole idea really came from what we were seeing happening in Europe, where some of the biomedicine clinics like Lanzerhof and Paracelsus were combining IV therapies with modalities, and together the results were just so much greater. And that's also what we were seeing here.
Yeah, so let's talk about those results. But you've been in this integrative medicine field for 25 years. And one of your primary tools that you use with your patients is IV therapy. Tell us a little bit about some of those benefits.
Yes, just like in conventional medicine, when a person gets a treatment intravenously, it's so much more direct, effective, and well absorbed. In our practice, people have a lot of health issues, including digestive issues. And when the digestion is off, like because of bad bacteria, or because of yeast overgrowth or malabsorption, gluten sensitivity, the digestive tract just does not absorb the nutrients as well as it could or it should. IV therapy delivers it directly into the bloodstream. You get exactly what you know that you're supposed to, and the effects are almost instantaneous. People start feeling better much more rapidly.
And why is it so much more effective than perhaps taking an ingestible or even doing a shot of something?
Well, taking something orally takes time to build up into the body. And in fact, actually, the oral nutrients that we give, the digestive tract is competing for those nutrients because it needs to heal itself. So oral medicine works, but it works best for the digestive tract. eventually gets absorbed into the body and builds up over time. When it's given IV or IM, then it goes directly to where it needs to go.
100%.
100%. And people get results much quicker.
So at Hamptons BioMed, there are 2 tiers of IVs available. One is the medically guided IVs, which are tailored to specific needs of the patients, and the other is the IV Light series, which offers the same high quality IVs and the nutrients as the medical IVs, but in lighter doses. And those are available for anyone that wants to come here. Can you speak about both of those?
Yeah, so when we have patients that we've been working with for a period of time, we want to be really precise about exactly the nutrients. And sometimes we have to very much individualize how much carnitine or taurine or
based on
amino acids based on their illness and their blood tests. So that's good for people that are need medical intervention. But the IV light therapy is a much more broad benefit for just about anybody who wants to improve their immune system if they're fighting off a minor cold, or if they want to have quicker recovery from exercise, or even get better effects from their exercise routines. So
what about chronic diseases?
It's a good starting point, but generally if a person has a chronic disease, they'll probably want to get an appointment with one of the practitioners and then get more precise about what they need. So
there's a lot of conversation around NAD and how it's improving sort of the intracellular pathways. What do you prefer and why?
NAD's become the hot button topic because it is for improving energy. Now what we've found, and I guess the research is also showing, NAD, which is actually the main ingredient for making energy, ATP, the precursor nicotinamide riboside actually works a lot better with less side effects. So people will notice a response immediately. People are able to take higher doses in quicker time, and the results are much quicker.
Yeah, I know that TAP, Frankie, who is your partner here, wrote a piece for us about NAD in Purist, and also NMN, which is sort
another
of
precursor.
a precursor and a support to NAD, right? It makes it more bioavailable.
Yep.
Explain that collaboration between the two.
Well, getting a little bit technical, NMN and NR are both precursors for NAD, and those can both freely get transported across the mitochondrial membrane, where all the action works from making ATP, energy. The powerhouse of the cell basically works quicker. NAD, interestingly, when taken IV or orally, cannot pass through the mitochondrial membrane, and so that's why we think when people are getting those IV treatments, they're getting a lot of flushing, which is basically a niacin side effect. It's a niacin flush.
So really, it's to boost your mitochondria, which depletes over time. There are so many factors involved that deplete mitochondria: environmental, illness, different things. So this is something that benefits everyone.
Exactly. As we get older, because of the toxins in the environment, they all kind of poison the ability of cells to heal themselves or make energy properly. This basically recharges it. It jump starts the cell's energy production, and then the cells can do everything that it needs to do better.
Oh, good. There's the article. So if you haven't picked up your latest copy with Uma Thurman on the cover, check out Tap Frankie's story on NMN and NAD in the latest issue of Purist, and also the puristonline.com. So there's so many longevity treatments here at Hamptons BioMed. You have the human regenerator, you have light frequencies like the Firefly,
the red light bed,
all of these healing modalities here. Talk a little bit about stacking and what that means for patients who come in here.
Yeah, the stacking is enhancing. It's when you put two together, you get three. That's what is happening here. And so when you're using something like methylene blue with Firefly, you get a photodynamic benefit. When you're using phosphatidylcholine IV with human regenerator bed, you're basically getting the energy, and then the phosphatidylcholine seals it in, like insulation.
You want to explain really quickly what some of these technologies are? For example, the human regenerator bed, which is relatively new. to this market?
It's brand new. I mean, there might be like 20 in the country right now, and TAP, through her brilliance, was able to get one of the first ones coming into the country. So it is electrons and ions that are surrounding the body in what's called cold atmospheric plasma, so that the body is fully absorbing electrons, which basically is ATP. It makes the cells make energy much more efficiently. So when people get the human regenerator bed, their cells are working better. But what we're finding is that unless we are able to seal the cell membrane more thoroughly with phosphatidylcholine, the benefits might not last as long as we want it to. So we are understanding how to use our modalities better for better outcomes for the patients.
Yeah, and this is all to support the immune system.
Immune system, energy production. Basically, if the cells are making energy better, then everything works better. Better digestion, better brain function, better immune system function, better nerves. Exactly.
Right. So you have a strong patient-centered approach, and your practitioners and you perform physical exams in an age where that just isn't happening much anymore. And why is that important to you?
Well, I grew up as a family practice doctor, and I still believe that the foundations still apply. Doctors should have a good relationship with the patient, and that happens in person. You know, there's still something about checking the pulse and listening to the heart and lungs and having an in-person conversation. There's energy transfer also from being in person, and which cannot really always be done through telehealth.
So I'm here with Dr. Jeffrey Morrison, the famous doctor from the Morrison Center in New York City, and he is here in collaboration with TAP Frankie Angola, who created this beautiful healing center in Southampton, New York, called Hamptons BioMed. Please check out the Instagram and the website at Hamptons BioMed for all of the different healing modalities that exist here. So Dr. Morrison, other IV centers offer formulations aimed at energy, immunity, detoxification, and recovery support. Do you offer similar wellness-focused IV protocols here at Hamptons BioMed?
Well, there's a lot of great offices out there, but I think what sets us apart is that we have a very specific, we're very detailed about the quality of our ingredients. My background is environmental medicine, so we want to make sure our ingredients are preservative-free. They are the allergy versions of the ingredients. So instead of getting corn-derived vitamin C, we use beet-derived vitamin C. It's little details like that that I think make it a little bit special.
Okay, so speaking of these ingredients, what are some of the hero ones that you're liking these days? Is it taurine? I know we touched on NAD and NMN, but what else are you liking?
Well, of course, phosphatidylcholine we love because it basically helps the cells cleanse themselves better. We love alpha lipoic acid, which is a fat-soluble, water-soluble antioxidant, which is great for liver healing, and it's great for the body's ability to regenerate itself. Glutathione, of course, is still fantastic as an antioxidant. And
what about some of the peptides?
Love peptides when we can get them, but the ones that we generally really love are BPC 157, which is the body protection compound, which helps with connective tissue healing, and thymosin beta, which is for inflammation in the connective tissue, and thymulin, or TA1, which is the immune regulator. It is so awesome.
Yeah, that sounds like that one I need. So here at Hamptons BioMed, you guys all focus on understanding a patient's terrain, that inner landscape, right? It includes nutrient status, toxicity, and infections. Before choosing an IV blend, can you explain that process?
Well, the way to think about terrain is kind of like the soil within which our cells are existing. And when the soil, the terrain is healthy, the cells are able to flourish and blossom and do all the things that they're supposed to do. But just like if soil is full of weeds or toxins, then our cells are not able to get nutrition in or get toxins out properly. So we do blood tests to understand better what the nutritional deficiencies might be or what toxins might be in the body. And by understanding that, then we will be very detailed and specific about tailoring IV protocols for patients.
And I know that TAP is an epigeneticist, and she conducts the DNA test, the epigenetics test. How important is that to do, in addition to the blood test, to determine your genetic
Well,
composition?
with a skilled geneticist like TAP, I think you can really get some unique perspectives that would be unable to understand from just blood tests alone. You know, how well the neurotransmitters work, or how well a person detoxes, or cardiac risk factors, or brain health issues. It's really, that's like next generation, and it's invaluable when a person knows what they are reading.
You've been doing this, as I mentioned earlier, for over 25 years now. What are some of the highlights that you've observed?
Well, quite ironically, it always comes back to the basics. So I really still feel very strongly that the toxins in our environment are having significant impacts on people's health insidiously. It's toxins and infections. So, of course, here at Hamptons BioMed, we're seeing so many patients with Lyme, but why do two people with tick bites get totally different outcomes? Well, a lot of that has to do with the toxins that people are exposed to. Mold, number one, it seems to be ubiquitous, I guess, in human areas like Hamptons.
Yeah.
And so
explain why mold is such a terrible toxin, and how it basically elicits whatever's brewing in your body.
Well, when there's water damage in a person's home, mold will be opportunistic. They'll start growing out of balance, and molds create mold toxins that we as innocent bystanders are breathing in. Depending on a person's genetics, like TAP would be able to identify, some people just genetically overreact in an inflammation way to the mold toxins that people are getting exposed to. And with that inflammation, then it interferes with proper immune system function. And that's how people can have like a low-level Lyme infection that insidiously becomes terrible. And then it's like rebuilding the body's immune system and detoxification pathways.
And you and TAP really are the Lyme experts. And we are in high season here in the Hamptons with tick infections. There are a lot of preventative measures now that can be implemented, but once you get that tick bite, that's the time I start getting a lot of texts and calls from friends, and I've sent so many people your way in TAP's direction. What are the immediate things that one can do when that happens?
Well, I personally recommend people get their tick and send it off to be checked. There's a company called tickcheck.com where you can get the tick, send it for identification so you know which tick it is, and they also do a PCR to see what infections it might have. I think if a person knows what infections the tick has, it could be easier for us to identify and treat appropriately.
And do tick bites always come with co-infections?
Not always, but probably a lot more times than we realize. Especially out here, for some reason, there's just a lot of Ehrlichia and Anaplasma and Babesia that sometimes go unrecognized, and then people get a blood test back that shows no Lyme, but they have something else, another tick infection.
So you get bitten by the tick, you send it out to a lab for analysis. That could take up to 10 days to 2 weeks. What is the treatment in that interim? And is it important to do anything while you're waiting on the results?
Well, if a person gets a bullseye rash, the typical bullseye rash, then absolutely they need to go on antibiotics right away for 4 weeks, in my opinion. And that's to treat Lyme disease. If they get symptoms like swollen lymph nodes or fevers or chills, that would also be another reason to go on antibiotic, like doxycycline, right away, because that could be Anaplasma or Bartonella. But usually we'll always want to check blood tests in 4 weeks after the bite to see what infections there are, just to make sure we don't miss anything. So we have to treat based on our clinical suspicion and then follow it up with blood tests to ensure we're correct.
Okay, and how do IV therapies factor into this treatment plan?
Well, both for supporting the immune response, because we do these great immune therapies with vitamin C and the minerals and amino acids, and also if we think that there's some toxin component to help the body clear out either the toxin from the infections or from what they might be getting exposed to in their work or home. Yeah. Very,
very important. Also, an immediate reaction can elicit a lot of exhaustion and fatigue in the muscles and all sorts of reactions.
Yeah.
So I think the IV therapies can help in that interim to keep that mitochondria and that immune.
It's all about
strong.
mitochondria. You got it. If the body's making energy properly, then usually it's doing what it needs to do.
So it's all about mitochondria. You heard that from the expert, Dr. Morrison.
I think you're the expert.
I'm still here because of this man. Seriously, it is just a great healing center. Everyone should come check it out. Hamptons BioMed. Dr. Morrison isn't always here. He's based in New York City, but
we've got great practitioners here like Jerry Simmons and Danielle. Fantastic people.
Yeah, and TAP's team, and of course all of those technologies that are state of the art and procuring longevity. And it's all about longevity and feeling your best and offsetting any kind of illness that might be coming at you. And this is also high season for random illnesses, stomach viruses, flus. I've heard from so many people, I'm sick, I can't do anything, I have COVID. What is your suggested treatment for those types of viruses and bacterial infections?
Yeah, and also don't forget allergies. It's been a very heavy allergy season too, which then makes a person more susceptible to these viruses that have been going around. So I do feel like the immune IVs that we do here help to boost the immune system.
Should one do that before travel?
Either before and or after, coming back after a trip, being on the airplane, or probably overdoing it on, whatever foods in the area you're visiting. Usually that means you want to come back and detox after that.
Yeah, and of course those are treatments that are natural, homeopathic and healthy. So you're not ingesting medicines per se. These are naturally producing elements in one's body. You're just boosting them.
Yeah, and basically the nutrients are like fertilizer. It helps the body to have the resources to do what it's supposed to do better. And it's, in addition to the mitochondria, it's all the other enzymes that go with it. So with the vitamins, minerals, amino acids, you are filling the tank up so the body can do what it's supposed to do better.
So I'm here with Dr. Jeffrey Morrison, the best landscaper of your internal terrain. So please check out Hamptons BioMed and schedule an appointment with Tat Frankie and her team and tour some of these healing modalities that they have here, as well as the IV therapies. Really, really special place. And thank you so much.
I think you're due.
I'm due for an IV.
We're going to get you hooked up right now.
I was just talking to one of my friends on my way here about when I had Epstein-Barr, and I was one of the first people doing the light therapies that you did,
That's
the intravenous light therapies. And that really, really helped me.
It's again, the light therapies, whether it's intravenously or now we're doing it topically, it still helps as an anti-inflammatory. It improves immune system function, circulation, powerful stuff.
Yeah, really powerful stuff. So I was there at the start of it all.
You totally were.
Dr. Morrison, thank you so much for joining me today. And for more information, you can go to hamptonsbiomed.com.
See you soon.
Bye. Have a good weekend. Great.
Okay, good job, guys.
Thank you.